Hey everybody, Zach here. I want to welcome you to another edition of Science for Social Distancing. We are now in August, drawing on 5 months into this quarantine. We are still here at the hospital treating more and more patients every day. And today we have a special edition for you. We're going to talk about lead poisoning in waterfowl. So I'm joined here by a very special guest, this goose. So this goose was actually brought into our hospital by Barnstable Animal Control. And you can see the goose is loose in the room right now, and that is because we are doing an ambulation test. Meaning we want to see how this goose moves around in the world, walks around, what his senses are like, because we suspect, based on the symptoms we're seeing, that he may be suffering from lead poisoning. So what we're going to do today is we're going to check him out. Dr. Patel and one of our vet techs, Justin, is going to come in, and we are going to catch him up, take a blood sample from him. I'm going to show you his x-ray, and we are going to see if we can either rule in or rule out lead poisoning in this goose. All right, so you all remember Dr. Patel?
Hi, everyone.
This is Jessin, and she is here on a grant as a vet tech to get experience in wildlife medicine. And this is the goose. We don't name our patients, but he is patient number 10, almost 1100, I think, for us. All right, so what these guys are going to do is they're going to catch him up after we've assessed him walk around. And while they're doing that, I will quickly say to you, what we've seen in this goose is he's moving around pretty well, but he is stumbling just a little bit. He's actually kind of moving around. Some people say it's a drunk walk, like he's having some trouble stumbling. You can see, that's how you catch a goose. Nice form, everybody. And so this goose was stumbling. He was also rolling his head a little bit. These are all neurological symptoms, meaning there's something going on either from a trauma or sometimes from a toxin that can cause them to be neurologically inappropriate and have improper proprioception, which means they don't exactly know where their limbs are in time and space. And so that is one of the key factors, key symptoms we see in lead poisoning. So what we do is we take a quick blood test, and you will see these guys are setting up here. You can see he's got the vein in his leg there. This is a pretty quick procedure. And blood's a valuable thing. It's a valuable diagnostic tool in our hospital. You can run lead, but you can also run a PCV and get a sense of all of the blood values. So with one stick, it's pretty easy to do. And while they're doing that, what I'm going to do is I'm going to quickly take you in, and I also want to show you something else that is going on with this goose. So we'll go into our x-ray room. By the way, we'd like to thank Northborough Canine for helping us purchase this critically needed piece of equipment, which is an x-ray processor. And that processor allowed us to grab this image just moments ago. So does anybody out there know or see anything out of the ordinary with this x-ray? You can put it right in the comment section. All right, well, I can tell you I spy 3 things right off the bat. That is 1 BB pellet here in the tibia tarsus, 1 probably in the coelom, and you're correct, Kate, it definitely got shot. And then there's 1 more that's a little bit deformed in the wing here. And this is one I suspect may not be an air pellet, maybe actually from a gun, and could potentially contain lead. Okay? So that is just sort of background information. It does look like, even though he's probably had a pretty rough go of it over the last couple of months, it looks like those shots are probably older. He's probably healed from that and compensating with it, meaning we examined his wings, we examined his legs. We didn't really see anything terribly wrong there. So those are absolutely embedded in him, but the tissue tends to encapsulate it. And so what we're thinking is if he does have lead, it's actually probably not from that lead, potentially lead shot in him. It's probably because he ingested it. All right, so I'm gonna flip you, put my on. All right. Oh, very nice. So you can see he's got blood. And this is going to go right into a green top tube. I'm taking the needle off just to minimize lacing of the cells. Cap that, and then you agitate it just a bit. So Priya, why do we see so many waterfowl with lead?
So lead is very concentrated in the environment. It comes from fragments of lead shot that get broken up and end up in the bottoms of lakes and ponds. There's also a lot of lead-based paints still around out there. Lead-based paints have been banned for household use, but it's still allowed to be used for commercial. So those yellow lines in the middle of the road are all lead-based paint. Paint on dumpster is all lead-based. So with a lot of water runoff with heavy rains, you can get a lot of lead entering the soils and into the lakes and ponds.
Very cool. So, for those of you out there who have never had to think about this subject, where does a goose get its food? Where is a goose eating? Right? Well, these guys spend most of their time with their butts up in the air dabbling at the bottom of ponds because they are down there eating both plant matter and macroinvertebrates, so those little bugs and insects. Right? So when you think about it, over hundreds of years, because lead is slow to break down, there's a lot of shotgun pellets and fishing sinkers, and then smaller paint particles, things Priya just talked about, run off. You know, water always follows the path of least resistance. It always works with gravity. So it eventually will settle at the bottom of a pond. And over time, sediment builds in, so leaf litter and more runoff cap this stuff. And eventually what happens is you get a good layer of benthic material, so there are plants growing, there are insects living there, but in that is mixed in some little lead particles. So when they're down there, they're not selectively only eating the plants necessarily. They may also be grabbing bits of lead and eating it. And now the body, because lead is so similar to calcium, you can't really expel it. So once it's in there, it bioaccumulates, meaning it builds up over time slowly, that it can have a pretty severe and cumulative effect. So most of the waterfowl we see suffering from lead poisoning, it's not just a one-time exposure. It's usually over the course of, you know, a few months, a summer, or even a lifetime. Okay, so we're gonna go right into the lab. I'm gonna pull my mask back up. And we're gonna take you over to the lead processor. It's a simple piece of machinery, but a very valuable one. And I'm gonna have Priya explain to you how this works and what we're gonna do.
So this machine is very similar to a blood glucose monitor. It's very rapid. In about 100 seconds, we'll get our answer. And so in here, we have a little vial, and it has a substrate in it here that's measured exactly to the amount of blood sample we're going to put in here. And it will bind if there's any lead in here, and then give us a sample to let us know how much lead is in the blood. We will not be able to know exactly his whole body lead level, but it will tell us how much is circulating within the blood.
Okay, so once it's mixed in, she's going to agitate that tube, and eventually it will turn a rust brown color. So you can see it's already starting to change. And once it does, it means that sample is ready for processing. Okay, and then you can see this test strip goes in. It's not unlike a glucometer. It's got a little test strip, and what you do is once that blood is agitated, you're going to take a pipette, take a small drop of it, and you're going to put it right on top of that X right there. You'll see through capillary action, it's going to fill there. And then all we have to do is wait 178 seconds, which we will spend with you guys, and we will see what this goose's blood level is. So can we go check on the goose?
Sure.
All right, let's do that. All right, so Priya, here you can see, here he is. He's actually standing, he's pretty bright. He's angry, which in wildlife is a good thing. We never want our patients not to be angry. And sorry, we lost you there for a second. But what I would love for you to do is, can you tell me what are the most common symptoms you're gonna see in a waterfowl with lead poisoning? And how can people out there identify if potentially an animal they're looking at might have lead toxicosis?
So unfortunately, lead can affect every part of the body. But the two main clinical signs we see are, one, neurologic issues. So they'll be very wobbly, they'll be stumbling as they're walking, they might not be able to stand, they might look like they're drunk as they're walking, and that's called ataxia. The second most common sign is that they're very, very skinny. So this affects their ability to digest and absorb nutrients. They can be, their feces can look a little bit bloody because the lead is very caustic to the GI system. which is why it's hard for them to digest and absorb nutrients. So the two major systems affected are the neurologic system and then the gastrointestinal system.
Nice. All right, so if you guys you're out there and you see a swan, a duck, a goose, and it's walking around, it looks like it's drunk, stumbling, having trouble, or even potentially being very quiet, laying down, that's a good sign that something is probably wrong. And it could be lead, it could be other things. But at that point, it's time to give somebody like us a call, and you're always welcome to do that, 508-362-0111. And we're happy to give you advice where we can. So now my question is, if we find out that this goose does have lead poisoning, what do we do about it? What's the treatment? Can you treat it?
Yes.
Yeah, good.
Yes, the answer is you can treat lead. And it's treated in a very similar way that we treat lead poisoning in humans. It's called chelation therapy. So if he has lead in his system, what we can do is we can give a medicine that will bind the lead and excrete it out of the body. It can be a very long process depending on how high the levels are. But after a couple of treatments, we're hoping that we can get the lead down to 0 would be perfect, but at least a low clinical level.
All right, very cool. So folks, it looks like we have something walking in the clinic right now. So I think we're gonna sign off here, but what I will do is we will update you on this goose's lead level. And if it does have lead, we will go through with the treatment you just heard. And if it doesn't, well, it's one thing that we were able to rule out, and we'll start with a new hypothesis. So I just want to remind you, we will keep doing these videos as often as we can. If there are topics you'd like us to cover, please let us know. We'd love to learn what you're interested in and see if we can help out. And then also remind you, treatments like this are not cheap. The calcium EDTA, the time, the lead test strips, it all builds up. We depend on your support, donations, and generosity to make this possible for all of our patients. So with that, this has been another edition of Science for Social Distancing. Be safe, wash your hands, and we hope to see you guys soon. Thank you so much.